Well, good morning, everyone. Thank you for joining us today on Veterans Day. In order to recognize this important day, we're hosting 3 separate community chats throughout the day to discuss the critical and multifaceted issue of veteran homelessness here in Orange County. If you'd like to tune in to any of those chat sessions, you can still sign up for them at the link below, or you can watch live on Facebook at noon and at 4 p.m. This morning, we'll be looking at the overall picture of veterans homelessness in our community and the work that is being done to address it. To help us dive into this topic, we are joined by Zulima Lundy, the Continuum of Care Manager for Orange County, Katrese Epps, Healthcare for Homeless Veterans Coordinator, Supervisor Social Worker for Veterans Affairs, and Denton Knapp, the Chair of the Orange County the Chair of the Orange County Veterans and Military Families Collaborative. So welcome to each of you. And I'd love, before we kind of dive into our meatier questions, I would love for each of you to briefly share what's your connection to addressing veterans homelessness. And Zulima, we'll start with you.
Thank you so much, Bex. So I'm going to talk a little bit about my office and then a little bit about my role. So the Office of Care Coordination works in collaboration with stakeholders to focus on regional policy and implementation of strategies that promote an effective response to homelessness in Orange County. That includes developing targeted approaches and leading efforts to better serve and address the needs of subpopulations, including veterans. So the Office of Care Coordination developed Marching Home, a strategy to end veteran homelessness in Orange County, which was adopted by the Board of Supervisors in July 2019. The Marching Home is really a local effort that ties in our regional and federal partners that aim to address and end homelessness amongst veterans in Orange County. And as a Continuum of Care Manager, my role is to support the implementation of the Marching Home strategy and also to support the Continuum of Care Board, who is the locally designated decision-making body for a number of state and federal funding sources that can help us develop new homeless services and programs to address the unique needs of each population. Additionally, I oversee the Coordinated Entry System, and the Coordinated Entry System helps connect people at risk of homelessness or experiencing homelessness with housing providers and supportive agencies. One component of the Coordinated Entry System is their Veteran Registry, and the Veteran Registry is the by-name list of all veterans experiencing homelessness in Orange County, and it really details who they're working with, their service providers, and it tracks their progress in accessing housing resources and attaining permanent housing. So a lot of the work that I do is in partnership with Orange County United Way, the VA, and a number of other community-based organizations to really coordinate services and collaborate to be able to meet the needs of veterans. Thank you.
Thank you so much, Zulima. You've got a lot going on, and we're really, really thankful to have you here this morning. So, Katrese, I'll turn to you next. Oh, Katrese, we need you to unmute yourself.
Thank you. Okay, can you hear me?
Yes, we can.
I am, as you mentioned, I am the Healthcare for Homeless Veterans Coordinator, and pretty much in my role at the VA in Long Beach, I provide oversight of all the homeless programs. And in our homeless programs, we provide homeless outreach, we provide transitional housing through our grant per diem. We also have our Community Resource and Referral Center, which is the entry and access point for our veterans in Orange County. We have employment coordinators. We also have permanent housing, and that's through our HUD-VASH program, which is also covered in Orange County and in Long Beach. So overall, we try to make sure that we have something available to meet the needs of the veterans, regardless if they are literally on the streets and homeless, if they are in need of transitional housing or permanent housing. We also serve as a liaison to the community by making sure veterans are linked up that may not be eligible for VA healthcare services. So we have a lot of different resources available at the VA for homeless veterans, and I pretty much provide oversight over all of those programs.
Well, thank you for everything that you do to serve our community and our veterans. Deeply appreciate it, Katrese. Denton, we'll turn to you. What's your connection to veteran homelessness?
Thank you, Bex. I'm Knapp. I'm the chair for the Orange County Veterans and Military Families Collaborative and also director here at the Tenure. And so a couple of things as far as our involvement with housing. One, for the Orange County Veterans and Military Families Collaborative, we have 10 working groups made up of 108 different nonprofit veteran serving organizations. So one of the key ones we have is the housing working group led by Corey Vigil and Jade Smith. It meets monthly, and that working group also covers the veteran by name list and CES matching for the Veteran Registry for homeless veterans. And there's about 280 right now, and that's done on a weekly basis to reconcile that in our attempt to place veterans by priority in affordable housing in the county. We work with Jamboree Housing right now as far as the Heroes Landing for veterans that are homeless to get them in. And we also operate the VASH HUD vouchers through CityNet and the CRRC inside the Tierney Center. So we're currently working remotely, but still be able to provide those services to include emergency critical needs funds for temporary housing shelter until they can get to their apartments, VASH HUD.
Thank you so much, Denton, for that great overview of your connection. Zulima, I'm going to turn to you. What information do we have about veteran homelessness in Orange County?
Thank you. So I'm going to point to the 2019 point in time count as a really great source of information that really helped us establish our baseline and understanding of veteran homelessness in Orange County. So during the 2019 point in time count, we had the opportunity to gather demographic and subpopulation data about individuals and families experiencing homelessness either in shelter programs or on the streets across our community. It included a question aimed at identifying veterans, any individual who self-identified as having served in the U.S. Armed Forces, National Guard, or Reserve. So every individual or family household that answered, yes, I have served, we provided an opportunity to reconcile our veteran registry through voluntary participation. So that included asking those veterans who were experiencing homelessness additional questions to determine whether they were already working with a homeless service provider and they needed help reconnecting with them, or collecting their contact information so that we could follow up afterwards with street outreach or other resources to be able to assist them in obtaining permanent housing and navigating the system of care to access the resources that they needed. So through the 2019 point in time count, we identified 311 veterans experiencing homelessness, including 99 veterans in shelter programs and 212 veterans living on the streets. Of those, we learned that the majority of the veterans are males, approximately 90%. Over half of the veterans were age 55 and older, so we definitely have an aging population across our veterans, and that comes with other challenges or, really an opportunity to wrap around services that can help them stabilize in housing. And we also found that nearly half of the veterans were experiencing chronic homelessness. And what that means is that these veterans have experienced homelessness for a year or longer and additionally have a disabling condition. So kind of looking at this broad spectrum of data, characteristics of the veterans, we have really been able to incorporate that data to develop the Marching Home strategy and also to serve as a benchmark as how we are doing in addressing veteran homelessness. I think it's really important to note that the 2019 point in time count provides us a step forward, and now as we look forward to January 2021, we can expect to conduct another point in time count, and that will provide us an opportunity to gather comparable data and really measure our progress in addressing veteran homelessness, and also take a moment to understand whether the characteristics or the needs have shifted, and be able to kind of develop programs and services that support that need for the population. As previously mentioned, there is a veteran registry, and this veteran registry is updated on a daily, weekly basis from all our different stakeholders and partners. Currently, there are 280 veteran households that are working on a permanent housing plan, and it's really important to note that the number of veterans on the veteran registry ebbs and flows. As veterans become permanently housed, that number shrinks. As new veterans are identified as experiencing homelessness and are being connected to services, that number grows. So we have seen a fairly steady trend of our veteran registry being between like 250 and 280 veterans at any given point in time.
Thank you so much for that comprehensive overview of the data that we have available to us. And I know that a lot of work has been done since the 2019 point in time count. So Katrese, I'd love to turn to you. If you could respond around what you've seen Orange County doing to address veterans homelessness. Oh, Katrese, we need you to unmute.
Have to keep remember to do that. The VA has been working with our community partners in Orange County towards the mission to prevent and end veterans homelessness. And so in summary, we collaborate with community in Orange County, our local, regional, and federal partners to strategize ways to identify chronically homeless veterans and make sure they are connected to the veteran registry in Orange County. We also identify solutions to housing barriers for our veterans. We collaborate on that, as well as serving as an access point in Orange County for our veterans to obtain housing resources and other supportive services. One way we have addressed the housing barrier is collaborating on project-based housing to provide housing resources to our veterans. In 2019, we were able to house 75 veterans at Heroes Landing in Santa Ana. We also have housed so far 29 veterans at the Placentia Veterans Village, and that is a new lease-up process right now that we're working on. We have Salerno Veterans Village, Salerno Housing that is coming up, and North Harbor Village. And so these are great opportunities for our veterans because of the housing stock issue that we did notice was happening in Orange County. It gives us an opportunity to provide permanent housing for those veterans, as well as the project-based housing provides additional supportive services that are there to support the veterans to help make sure they are able to maintain stable housing and get the support and resources they need because staff are on site. To provide that care and support, any type of case management services. We also have at the VA worked very closely with making sure that we are part of the by name list meetings that happen every week with the community to make sure that we are identifying veterans that are appropriate for permanent housing through the project-based housing, as well as matching them for if they're not eligible for services with the VA, that they are able to be connected to community resources that they are eligible for. So a lot of our efforts have been trying to get veterans either housed with the tenant-based vouchers for permanent housing or working with the community to make sure that we are, working towards the mission to end veteran homelessness. I think the project-based housing has been a great resource to the community in doing that.
Thanks, Katrese. So Zulima, I know there have been a couple of other things that have been happening as well as the project-based permanent supportive housing. Could you fill us in on some other things that have been happening here locally to address veterans homelessness?
Definitely. So there is a program called Welcome Home OC that the County of Orange helped pilot with Orange County United Way and United to End Homelessness to identify interested landlords that were able to make units available to those veterans that had rental subsidies, either through a head voucher or through other means such as supportive services for veterans families. And United Way worked with all these landlords to identify available units and then also work with the veterans that were searching for housing units to be able to make a match and, find housing that met the needs of the veterans and was able to expedite the process to get into housing. And I think that has really been a tremendous effort being led. It has reduced barriers to housing and it has also addressed some of those occupancy and vacancy issues that Katrese mentioned in her response. By being able to have available units, veterans are able to move quickly into housing. In addition, they're also being provided with some basic necessities that kind of change an apartment into a home, from furniture to kitchenware, bedding, and all of these things that really make a space homey for the veterans. The Welcome Home OC program has really been successful in creating partnerships and kind of creating awareness about this effort to end veteran homelessness and be able to quickly house veterans in appropriate housing. Additionally, it has provided veterans with additional supportive services so that they're able to maintain their housing long term and that they're able to stabilize and kind of integrate into the community by accessing other community-based services. So the Welcome Home OC program has been really successful in terms of quickly identifying units and also making sure that veterans are not going through this process of finding housing all by themselves. Additionally, I like to note that really the Welcome Home OC program is a really nice complement to the Marching Home strategy as it aligns with some of the efforts that the County of Orange was trying to do, right? There were certain metrics that we were trying to meet in terms of reducing the length of time somebody is searching for units or the length of time that someone is looking for housing. Thank you.
Thanks so much, Zulima. Yeah, and I know that we've been incredibly grateful for the partnerships that we've had to be able to support the work of Marching Home and for our incredible collaboration with the VA on our work with Welcome Home OC to be able to reduce some of those timeframes. And we'll dig more into that in the community chat at 4 p.m. if anybody's interested. We know that veterans who are experiencing homelessness have some unique needs. And so, Denton, I'd love to get your thoughts and your insight on this.
Thank you, Bex. For veterans, just here in Orange County, we're estimating between 100 to 130,000 veterans, and then you add their families and all of that population. So one of our biggest challenges is identifying them. Most veterans won't come forward and say, you know, I served, I'm a veteran. The ones that we have coming in for help really need the help, and we see them, but there are other veterans that may be in unaffordable housing and on the verge of, you know, losing their apartment or becoming homeless at any time. So one is identifying them. So, you know, outreach through our veteran services community here of actually asking the questions. And we actually have a campaign for the collaborative this year, Ask the Questions. And the first one is not, are you a veteran? Because a lot of veterans will say, well, I was in the Guard or reserves, or I didn't deploy, or I didn't go to combat, so I'm not a veteran. Not true, you're a veteran. So we started asking, did you serve? And that question, did you serve in the Armed Forces of the United States? Yes, okay. And then you can go deeper into the questions to help them out and find out what they really need. The other question we ask is, do you have family? Because a lot of times the spouses, children have other needs besides the veterans' needs. A lot of times we have the spouses come in for help because the veterans won't. So this idea of identifying who the veterans are and then really being able to neck down into what they need. So for the county, the policy of housing first gets you in a safe location with whatever property you have, where you can start focusing on other things like behavioral health, like food, like employment. So being able to pair these other really primary needs for veterans to get an income to be able to afford the rent, to be able to sustain themselves with food, take care of their families. And some of them have been living in cars, some have been on the street. And it's one payment of missed rent. A lot of times that will be the difference between having a house that you're in and being in your car. So it's important that we take a look at all those. And we've got a lot of partners that do that. One of the issues of the veterans is getting their benefits. So being able to identify who has and who has not applied through VA for disability, which is a lot of times a certifying factor in being able to get a lot of different services. Veterans Legal Institute's here, and they can actually do discharge upgrades in some instances to assist veterans with employment or actually getting into housing programs. Emergency funds are very critical right now, especially during COVID. So partnerships with not only grants and corporations and donors on the government and the nonprofit side, but also other agencies, American Legion, VFWs, Association of U.S. Army, that we can all pair together. We may not be able to pay somebody's $3,000 rent for the month, but together we can. And you know, being able to give that, and that's a great help with United Way's program during the COVID time. I think we were able to help about 50 families through, you know, Tyranny Center's involvement. But it's about pairing together. So 211OC also helps with referral. They're actually in our building and able to, when you dial 211 and hit 1 for veterans, it actually gives you an array of requirements and referrals that you may need to include housing. So we find one of the biggest things we have right now going on is help with rent, help with utility, help with temporary shelter while waiting for VASH HUD vouchers, and then getting an actual affordable housing. So it's very important right now. We're able to do this remotely during COVID through purchase cards, gift cards, gas, food, that type of thing. And it's really a partnership between all the community and us being able to call each other and get the veteran what they need without them having to drive all over Orange County.
Thank you, Denton. Katrese, I would love to turn to you from kind of your expert point of view in terms of the work that you do specifically with veterans who are experiencing homelessness. Are there kind of unique needs that a veteran may have over, say, the general population experiencing homelessness?
Yes, there is. And what we find is because of that, a wraparound approach really helps in working with the veterans. Oftentimes we see that there are challenges that are there that are contributing to some of the housing instability. And so what we look at is trying to make sure that we are linking them to resources to support them towards work getting housed and maintaining their housing. And that can be addressing challenges with mental health, medical issues or concerns that are going on with the veterans, any legal issues that they have that they need to resolve, working on any type of employment challenges they may have and getting them ready for employment, and in the process for applying for jobs and positions, help with resumes, and helping them work towards self-sufficiency and housing requires a lot of support to keep the veterans going and to get them involved and invested. And when we work through some of the challenges that they may have with mental health, someone could be dealing with depression, they could be dealing with substance abuse. Those are all contributors to whether or not they'll be successful or not in their housing. And so we have case managers that are part of our permanent housing with HUD VASH that helps them based on their acuity level and meeting with them on a regular basis to assess and reassess on a regular basis to see where they're at, what resources they need to be connected to the VA or in the community, as well, and working with outreach. Sometimes we identify veterans who are homeless that, as Denton mentioned, may not even know what services they are available to them, and connecting them with VBA to learn about their benefits and opportunities that are available for them, getting them linked to the VA. They may have never known that the resources and services were out there. So having our outreach team get out there in the community and connect them back to the VA, making sure they're connected to coordinated entry system. There might be families that are out there that may not be eligible for VA healthcare services based on their discharge status, but they may be eligible for services through SFVF or other community partners. So I think in order to see our veterans be successful, it requires a lot of wraparound approach from the VA and the community in helping them to navigate the resources that are available to them, as well as just providing that supportive service that they need to work towards that housing stability. We even consider food insecurities they may have, making sure that they know what resources for food is available to them as well, resolving any legal matters that might get in the way of their housing. So I think those are looking at all life domains and where the veteran is in need of, and developing an individualized plan tailored to that veteran so they can be successful.
Thanks, Katrese. And I've just seen the time, and we've been having a great discussion, but we are running out of time here. So I'm going to ask for just a really quick response to my next question. What do you think some wins are that we've had as a community when it comes to addressing veterans homelessness? And Katrese, I'll go straight back to you.
Okay. One of the biggest wins I think we have in Orange County is that our collaboration with our partners are really strong. I think it helps us to develop processes that aggressively get veterans through the process towards housing. Working with United Way has been awesome. When we were noticing we were having challenges with the housing stock, it was great to have that landlord incentive there for us to be an option for us to help with the veterans being housed. So I would say the biggest win is we all want to work towards the same mission, and we collaborate and strategize in a way to make that happen.
Thank you, Katrese. Denton, what's a very quick win you've seen?
One is getting the strategy done, because that really lays out a timeline and an end state for housing our veterans. And the Marching Home, as well as the Welcome Home programs, have done that. One interesting thing that started in January was the Humvee program with the Orange County Sheriff's Department. It's a housing unit for military veterans. And they've actually separated that population into their own cells, giving them camouflage jumpsuits. And actually, we go in and provide services as a community for education, housing, employment, and mental health. So as those veterans leave the jail, they've actually got a place they're going to go live. They've actually got work they're going to do, and there's only a 5% recidivism rate for them coming back in after they're released. It's a great program that was recognized by the county for the Sheriff's Department to start, and it's one of the housing things that we're doing as a community. Win.
That's awesome. Thanks for shedding some light on that, Denton. Not many people may be aware of it, so thank you for talking about that. Zulima, I'm going to come to you next. We often get people asking us how they can assist, how they can help a veteran who's experiencing homelessness. How would you advise them?
I think that as you engage veterans who are experiencing homelessness, the best thing to do is to try to connect them to one of the professionals, some of the street outreach providers or homeless service providers. The work that the VA, the work that the OC, Goodwill Tyranny Center, and a number of other of our community-based organizations is phenomenal, and they're able to assist those veterans to navigate through the system. I think that it's really important to be able to provide that linkage and support veterans in accessing resources. And then I would also encourage people to volunteer and support these community-based organizations because they're able to leverage your volunteer hours or your donations to be able to help veterans in very unique ways that address their unique circumstances. So definitely volunteer, get engaged, learn more about the system in ways that you can support not only one specific veteran, but the overall effort to end veteran homelessness.
Thanks, Zulima. And then Katrese, I'll finish with you on this one. Is there kind of a place in Orange County that veterans experiencing homelessness could be directed to be able to access services?
Yes, if you come across a veteran that isn't homeless or at imminent risk for being homeless, please direct them to the Community Resource and Referral Center. We have staff there ready to help.
Fantastic. Thank you so much for that. And we are running out of time. It's at 10 a.m. So I'm gonna wrap us up there. Thank you so much to each of you for all of the information that you have provided. We've got 2 more chats happening today. At noon, we'll be talking with the Apartment Association of Orange County, the California Apartment Association, and Jerry, who's from Main Street Management, and that conversation is around how property owners are getting involved in solving veterans' homelessness. And then at 4 p.m. tonight, we're going to have a special conversation about the work specifically that we're doing with Welcome Home OC. We're going to have the VA join us for that conversation, as well as our service providers. We're going to talk about the work that we do to help get people housed. So this brings us to the end of our first Veterans Day community chat. Thank you again, Zulima, Katrese, Denton. It's been great to be able to talk with you this morning, and thanks to everyone who joined in, and we will see you later today.
Thanks for having us.